right. It is 5 o'clock, the time that we get together every single day. We talk about the coronavirus, we give our update, and we recommit to doing everything it's going to take to protect our fellow Kentuckians as we get through this. So let's start the way we always start, by knowing and saying we will get through this. We will get through this together. Say it with me. We will get through this. We will get through this together. One more time. We will get through this. We will get through this together. We will. We absolutely will. It's going to be a tough road. It's going to be difficult days. But we are going to make it. We are going to come out on the other side. We are going to rebuild. We are going to be a prosperous Kentucky where we can all get out and see each other, be with each other, celebrate birthdays, anniversaries. We will get there again. Remember that while other generations that were called to face challenges like we are called to face, most of the time when they faced them, the time or even the victory was uncertain. We know here, we're not looking at years, we're looking at months. And we know that we will come out of this on the other side. So that ought to mean that we can be strong, knowing that it is some limited duration, even if we don't know the exact duration. And we ought to know that for the first time in my lifetime, what every single one of us does matters every day, every decision, every action. Because of that, our collective actions, our unity is more important than it has ever been. So let's be that united Kentucky that we always dreamed about and that I know that we can be. So we're going to get through this because we're going to follow the 10 steps that we now talk about every day at the very beginning. Number 1 is staying healthy at home. It is a beautiful weekend, but you absolutely cannot violate these rules simply because it's nice. When that happens, the coronavirus spreads and people are more likely to die. It's a tough reality, but it's a reality we face until we get past this coronavirus. So, be healthy at home. You ought to be at home. Unless you are getting some exercise, unless you are going for groceries or other supplies, you ought to be at home. And getting out, getting exercise is a really good thing. Just make sure, again, that or supplies or a hardware store or you pick is not an opportunity just to try to get together with other people. We've got to be better than that. We've got to make sure we do this right. We've got to defeat the coronavirus the very first time. And I'm going to show the slide I showed for the first time yesterday. How well we do social distancing it matters in terms of thousands of lives. Avoid crowds and gatherings. There is no exception to this whatsoever. Every crowd spreads the coronavirus. Any time that you need to go to something and there is a crowd, don't go. Come back at a later time. Now, while we are doing everything we can to restrict, close, or change venues that might create a crowd, remember it is your responsibility not to be in one. Practice social distancing. So this is when you get out for your run or you're going for a walk with your kids, the dog. If you come across somebody, you can smile, you can say hi, keep your social distance, and keep moving. Incredibly important. Knowing when to seek care. And if you'll put that slide up, this is important now. It's going to become even more important as we see our surge increasing. Make sure if you are healthy but nervous, you call our coronavirus hotline. If you are sick but would have otherwise not sought care, call your primary care physician. But make sure whoever you're calling. You're using telehealth. You are not going in where you can be exposed to the coronavirus, and you're not taking up those resources. But if you are truly sick and you need help, or if you're injured, go ahead and seek that care. kycovid19.ky.gov. That is the source to get the information and guidance you need. We're going to have guidance up on masks now that the CDC has changed their policy. We'll talk about that in a minute. That should be up on kycovid19.ky.gov right now. It's a place you can go, read all of the guidance that we have for you, and know what we ought to be doing. Wash your hands, wash them a bunch, wash them every day. And I know when we're washing them so much, all of a sudden we start decreasing the amount of time that we do. We go from 20 seconds to 10 to 5, and you think, put soap on them. No, 20 seconds every time. It's important for your health, not to get the coronavirus, but we all have to act like we have the coronavirus, so it keeps us from spreading it on other surfaces where people could get it. Make sure you clean your house. If you're going to work, your place of business, your area. If you can't find the industrial cleaners, use the 1-100 bleach solution. I'll tell you what, in the next couple days, we will show how to do that again, though there is a video on the website. Apply for benefits. This is unemployment. This is Medicaid. We are all in this, and we're going to get through it together, which means you need to have enough to get through it. I'm going to ask Eric Freelander here in a minute to come up and to talk specifically about Medicaid. On unemployment, I know we are doing better, but there are still many of you out there that are getting error messages or saying that you don't qualify. You qualify. We're going to make sure it happens. Stick with us. Prioritizing your mental health. It's really important. We've talked a whole lot about kids. We're going to have somebody come in this next week and talk especially to our seniors as well. I know it's got to be challenging if you are in a senior care facility or if you've lived on your own and all of a sudden you can't see so much of the support that's around you. Make sure that you are taking steps for your mental health. Make sure you are taking care of yourself. And folks, when you are out there getting that exercise and you're walking past people and just smiling and saying hi, just ask them one question. Are you taking care of yourself? Make sure we're asking that to each other as we go through this. It's a powerful, important question. It shows your compassion, and then it makes people question how they're actually doing, and then hopefully doing those things to get to the better place. Because let's admit it, none of us are okay. None of us are okay. This is tough. It is difficult. It's a world around us that we have never seen and experienced. So all those things we do to make us feel better, to stay connected with people, all the Skype or the FaceTime or the Zoom, any of those things that you do, isn't just important to stay in touch with people. It's important for you. Make sure you're doing those. Do not travel anywhere. It's not just to other states. Certainly don't travel to other states. We have orders in effect. If you travel to other states outside of some exceptions, you're going to have to self-quarantine when you get back. If you travel from another state to Kentucky to ride this thing out, you are going to have to self-quarantine. You can no longer come into Kentucky and stay a couple days. That's not the way it works, and that's not the way it's working in any other states as well. And finally, report the non-compliance. So those are the 10 steps that we use to defeat the coronavirus, plus one, fill out your census. I'm going to say it until everybody has filled out their census, because it's going to be really important as we are rebuilding to make sure we're getting the federal dollars for all of our people. If you haven't done this, please do it. If you want to put it on social media that you've done it, do it. That creates good social pressure too. And so 10 steps, the census, but the other thing that I've been asking you all to do day in and day out is to model the type of behavior that we want. We're never going to be able to use simple enforcement to get where we need to go, to engage in the social distancing that we need to get to. It takes you all. It takes you doing the right thing. It takes you being proud of doing the right thing. And it takes you encouraging other people to do the right thing, especially when it's hard. So we've asked you to fill up social media with hashtags Team Kentucky, Together KY, Patriot, and Healthy at Home. And here are some of today's social media posts that we wanted to highlight. The first one we're going to play right at the end. All right, these are, again, our frontline healthcare workers. And you want to know what they put themselves in front of every day? Just look at this picture. This is the PPE that we talk about that's desperately needed for them. The number one thing you can do to help these folks, and the picture really brings it out, is to stay at home, is to not go to any crowds, is to do everything you can not to spread this virus. That protects them, and it also saves lives, as we'll talk about. I thought this was pretty incredible. Look at this. At a time when some people are shopping for a month's worth of stuff, when some people go to the grocery store and there is not toilet paper or disinfectants or other things that they need, as you can tell, these kids put it out for free for anybody in their neighborhood that need it. That's being a good neighbor. It's making sure everybody has enough. This is the example. If we follow it, we will all get through this, and you know what? They're helping us get through this together. Again, I know that people are missing important moments in their life. But when people make the decision to do the right thing, to engage in social distancing, and put it out there that you can still, you can see the joy on his face of seeing his nephew, right? We can still have those moments. We can still share that connection. We can still have that emotion while practicing social distancing. All right, this one was just really funny. These are a couple of kids and parents, apparently, that have all the time that we all do. I love in the second slide that they have both Virginia and Kenneth. And these kids seem to be doing a pretty good job at it. Again, these are our healthcare workers. These people are the reason that we're going to get through this. These folks are working so hard every day. They're doing their part. They're showing their courage. Make sure that you are doing your part as well. And we've asked you to do a couple different things. We've asked you to ring bells at 10 a.m. And you know what? If you don't have a bell, bang on something. It's just let people know around you that they are not alone. And every night that we lose somebody, and folks, this will be most nights for a while, we want to light our houses and other places up green. I got a message from someone today that said yesterday, thanked me for mentioning you could paint around the light bulb. Let's try to make sure in as many of our neighborhoods, as many of our institutions around Kentucky, that we are showing the compassion, green being the color of compassion, as well as renewal. It says that when we lose someone in Kentucky, we've all lost, but it also is showing that there will be a better day ahead of us. All right, so we have talked about how this month, these coming weeks, are absolutely critical. We have to have everybody's very best. That includes this weekend, that includes next week, that includes the week after. This is the time where we do what it takes to protect the people around us. And we've shown you a couple different models. First, there was the model that we showed you based on the White House's numbers. And that showed you with intervention is the social distancing that they talk about, that if we worked under their assumptions and we really did this well, we would protect a number of Kentuckians. Not doing any social distancing, up to almost 30,000 people we'd lose. With social distancing, between 1,300 and this model, 3,200. Those are people we love and care about. They're not just a number. Separately, we showed you yesterday a second projection, and this is from COVID Act Now. And as we said, we think the White House's numbers, at least when we look at all the models, are actually somewhat optimistic, and we all hope they're right, and I'm committed to doing better than any of these models, but this is one that's out there that a lot of people think is a good modeling. And what it shows here is the difference, not just in no action, because we've already taken action, right? The limited action slide, we were way beyond in Kentucky. We acted aggressively. We worked fast. That shouldn't happen. But what it shows is the difference between whether we really do social distancing right, whether we really follow all these restrictions, whether we do everything we can even when it's a beautiful day, or whether we invite folks over to our house because we've missed them. Whether we think if you just have a couple of couples or families over, that it doesn't really matter. That's the difference between poor compliance and strict compliance. And in this modeling, it's the difference in 11,000 Kentuckians. So what you do matters. What we all do matters. That is a significant number of people. And how great would it be? And it's tough thinking something would be great given what we're facing now. But if we could look back 5 years from now and say, well, it wasn't easy. We did what it took, and we saved 11,000 lives. I think that's something worth sacrificing for. I know it's something worth sacrificing for. And I need each and every one of you to believe when you stay home, you're doing a patriotic duty. You are. Sounds strange. It would have been, 4 months ago, we would have thought we should be getting out and doing something. But right now, just being at home, limiting those interactions may be the difference between somebody being with us 3 months from now and somebody not. So very important. All right, the 3 ways that we do everything we can on that strict compliance and to protect as many Kentuckians as possible is number 1, our social distancing. That's all the restrictions that we've done. And let me tell you something. It's working. It is absolutely working. We can see it in some of the numbers we see in cases, but I'm going to give you better proof than that it's working. Can you show the influenza slide, James? So flu also spreads in a way to where if you practice social distancing, it cuts down on cases of the flu. And Kentucky, you've done that. We have significantly less cases of the flu, especially since March, when we started taking a number of steps. Let me tell you, the social distancing is working. It is preventing wider spread of certainly the flu. Now, we believe the coronavirus spreads a lot faster and a lot more aggressively at this point. But look at this. Look at that downward trend and know that if we stick with this, if we follow the rules and restrictions, we will absolutely lessen or slow the spread of the coronavirus. This shows you that it's happening, and I'm proud of you. I'm proud of just about everybody out there who is doing the right thing. And it's virtually all Kentuckians. And I have to talk about some of the ones that aren't. But what I don't talk about enough is the great job you all are doing. Keep it up. We're doing this together, even though it seems like we are apart. Number 2 way that we do it is increasing our healthcare capacity. Can you show the key numbers on that? So our healthcare capacity, and this is what we're trying not to overwhelm while we're trying to cut down on the cases, this is where we started. Right now, I believe conservatively that we can get our number of hospital beds up to 25,000. We already have plans in place to do that, and I actually believe we're going to have plans coming through this weekend that will do significantly more than that. And this is everybody working together. These are our hospital systems, though their numbers aren't included in the expansion plans that they can put together. It's what UK announced and what we've talked about at the fairgrounds. It's about using hotels in a way where we already have at least 3 under contract. It's making sure that we create phases, which we have, and we'll step through probably this coming week about how we increase that capacity. ICU beds and ventilators also critical. I will tell you that ventilators, like PPE, are starting to become almost impossible to procure. We had a big order on convertible, not hospital-grade ventilators. You can't get those right now. We were trying to buy any ventilator that we could, knowing that if it could help somebody even for a period of time. And even those right now are very difficult to get. So these are the healthcare capacity. The other limiting factor is PPE, personal protective equipment, and we've got a new list of some of those. Have we loaded that one up? This is just a little bit of what PPE can be. It's everything from the masks to the gloves too. They call them the gowns. If we look back at the picture, it's the clothing that folks were wearing, and a number of other critical pieces. The N95 respirators are by far the hardest to find right now, and I will tell you, virtually every order that we and that any other state is putting in is getting bought out either by the federal government or being sent directly to one of the hot spots that's out there. It is a challenge, but we go to work and we fight for everything that we can get each and every day. So there are 3 ways that we make sure that we have the PPE we need. Number 1 is we try to buy it, and that's the challenge right now. Number 2, we're looking ways to manufacture it. And let me tell you, if you are a Kentucky company and you think you can do any of this, give us a call. If we can create our own manufacturing base to create PPE, we will be in a better place than just about any other state. We can work with you on the specs. Some of these are very hard to make, some of them not as much. But if you can help us with any of these, we want you to be a part and call us. So number 1, we try to buy it. If you can manufacture it, we'll buy it. Number 2, we're trying to create new manufacturing bases for it. And number 3, we need you to donate it. We know that there is still a lot of personal protective equipment, gloves, gowns, face shields, goggles that are still out there. Here's the number and the website to donate, and you can also take it to any of our Kentucky State Police posts, especially right now when almost all of this is going out to just a couple of states and what they're dealing with. Every single bit that we can get in and that we can create is going to go to a good use. And let me tell you, we've had huge numbers of donations. We have a state filled with good people that want to help. And helping, donating, helps us feel a little bit in control of a situation that feels very difficult to grasp, an adversary you can't even see, and moves in ways that make us feel like we don't have that control. This is one way that you can know that you are doing something to help in our battle. All right, there was new guidance by the CDC last night on cloth masks worn by you and me, folks that aren't on the front lines, and now suggesting that is something that people should consider doing. Let me start by saying I'm going to read the recommendations here, but no one outside of a healthcare provider ought to be wearing an N95 mask. If you are doing that, that means that someone who desperately needs it doesn't have it. Our same test of being a good neighbor as it comes to testing and hospital beds applies here now too. If you are wearing a surgical mask, we ought to really think about whether there is a healthcare provider that should have that. Now, the cloth masks that are out there that people are making, those are the type of masks that they're talking about in the recommendations I'm about to read. So, this new guidance is on kycovid19.ky.gov. We know that it is being spread through saliva and nasal secretions produced by coughs, sneezes, singing, and talking. Social distancing measures remain the primary and most effective steps to reduce the spread. Wearing a mask does not replace the social distancing requirements. Let me repeat that. Just because you wear a mask doesn't mean you can get within 6 feet of somebody and have a conversation. That will still spread the coronavirus. Number 1, follow the social distancing guidelines. Number 2 is the mask piece. In settings where essential activities make social distancing more difficult to maintain, if you're in a grocery store or a pharmacy, the CDC is now advised that wearing a cloth face mask may help reduce the spread of COVID-19. So, think about it this way. If you are going to the grocery store, and once you're in, you can't control how many people are in. Because remember, if you show up, there's a huge line, go home, right? Order it online. Figure out a different way. But if you're there, and you know that there will be other people in the store and you can't control everyone else's actions, that's one of the times that they're suggesting wearing the mask. And what it does is it prevents those droplets from coming from you towards anyone else. And that's actually the primary protection, is that if everybody does this, whoever has it is not potentially spreading it. So wearing a cloth mask in public when it is more difficult to maintain social distancing may help reduce the risk of it spreading. Wearing a cloth face mask, you can't touch your face, right? And that's the challenge. So if you've got a cloth face mask on and you're moving it around a bunch, it's not helping you. It's actually hurting you based on everything you would be touching in a grocery store or anything else. So again, if you're going to wear a mask, which is advised in certain situations, maintain your social distance, don't touch your face, and do not wear surgical masks or N95 masks. We need those for other people. This is a voluntary public health measure for Team Kentucky, but that is the guidance that's coming from the CDC, and that's what will be up on our website. All right, now I want to very briefly before we give our update, we have an update about Medicaid from Secretary Eric Freelander. Thank you.
Very briefly, the 10 steps to defeat the coronavirus. Step 5 and Step 7. Step 5, go to the website. Go to kycovid19.ky.gov. Go there. When you get to that website, scroll down and look for something that says Services. Click on that Services button. The reason I'm asking you to do that is this. There is a very fast way to get health care coverage, and it's right there on that site when you click on the Services button. There's a one-page application that can get you health care coverage through June. And if you fill that one page out and you don't have insurance, we will make sure that you have health care coverage at least through June. If that application feels like it's too complicated, and we've taken a 20-page application and made it one, you can click on the button that says Assister, and it will get you to somebody locally who can help you get that health care coverage. Now, why is that important? Well, obviously, everyone needs that health care coverage. But if you're worried about, oh, well, I don't want to cost anybody anything, don't. Getting health care coverage is how we get reimbursement, how we fund all the folks that are trying to help us in the healthcare field. So if you have coverage, we can get them paid, and we can keep them going. So please, go to this website. If you don't have healthcare coverage, fill out that application, and you will get covered at least through June. There are other sites here. There are numbers that you can call if you need help with food or buying groceries. That's what SNAP is about. So you can call the number that's there. The calls are answered between 8 and 5 Monday through Friday, that's Eastern Time, and 9 to 2 on Saturdays. You can call and get some help with buying groceries. If you have an immediate need for food, you can always use the 211 number that's staffed by the United Way and find your local food banks. So please, Step 5 and Step 7, go to the website, hit the Services button. If you are uninsured, we can get you covered through June. Please sign up. It will help all of us. Thank you.
Okay, so today's update is again, when we put things into relative terms, an okay update. Once again, we are not doubling numbers that we have seen in previous days. In fact, our numbers for the last 3 days seem fairly steady. So today we are reporting 92 new cases of the coronavirus. And as you all know, we are continuing to audit and to go back, and so we had to adjust yesterday's number downward by 6, which again were duplicates and or people that were out of state. So our total number of cases as of today in Kentucky, our official number is 917. And we can now confirm that more than 16,663 people have been tested, though that is a low number. We know that it is much larger, and we're still not getting all the reports from all the labs on everybody that has been tested. Sometimes we just get the numbers of positive. Over the course of the reports we've been giving you, we know that a little over 130 of the 917 have been hospitalized, and 76 are currently hospitalized. I don't have an update on the recovered numbers as of today, but we will have that, and we are tracking that as we go forward. New cases by county, and remember, we're on a different reporting time than some of these other counties. 45 in Jefferson, 5 in Hopkins, 5 in Simpson, 3 in Christian, 3 in Davis, 3 in Hardin, 2 in Henderson, Lyon, Marion, Perry, and Shelby, and 1 in Boone, Bullitt, Caldwell, Clinton, Fayette, Franklin, Kenton, Lewis, Meade, Mercer, Ohio, Warren, Washington, Wayne, Webster, and Woodford. So folks, this is the map that is on our website. There's going to be a couple new counties that are shaded in. This should show you that it's everywhere. That any county that is white on here, there are cases. There hadn't been a confirmed test at this point. So I hope this map now gives us an idea that this coronavirus is everywhere. And tonight, I've got a report that we have 3 new deaths. And while 3 is certainly less than we've had the last 2 days, these are 3 people that are loved and cared about by their family and by their friends. That loss is just as important as any loss that we've reported on other days, even if the numbers were bigger on other days. These 3 individuals include a 56-year-old female from Fayette County, a 52-year-old female from Bullitt County, and an 81-year-old male from Boone. I've been asked another day about who some of these people are, and we've tried to be very careful about individual stories unless people are willing to talk about them. It's very personal to a family. It can be protected health information. But we had the family of Aaron Jordan, if you can, that wants to share his story. And Mandy McLaren wrote a real nice article about him that includes a lot of information. So Mr. Jordan was 49. And I'll tell you what that means to me. He's 7 years older than I am. He's 49. In good health. He's from Boyd County. He's a union bricklayer. He has 7 kids and 7 grandkids. So when we're talking about doing our duty as a Kentuckian, as a patriotic American, as we're talking about reducing our contacts, as we're talking about the difference in the loss that we're going to have if we strictly comply versus if we poorly comply, this is one of the folks that we've lost, right? An amazing person, loved by his family and by his community. So every one of these losses is very, very real. And today with these 3, we're at 40. We're at 40 here in Kentucky. And there's going to be more. And there's going to be a number more. And while we can model what we think we'll see, no one's ever dealt with this virus before, I can't tell you a final number that we might hit of people we lose if we strictly versus poorly comply. But what I can tell you is that there will be individuals that are still here for their families and for their friends if each and every one of us does our duty. That's not just me saying that. It's his family saying that too. They're sharing their pain and their loss. He was in Detroit doing a job and insisted that he be helped up there and quarantined up there to not bring it home to his family. Think about that. he made a decision that even in his last moments in life, he'd rather protect them than maybe get that connection, that closer connection that would have helped him during that period. It's the type of sacrifice, and this is his family's sacrifice, that they are making in their most difficult time to make sure that this is very real for all of us. All right, let's do about 10 minutes of questions. It's Saturday afternoon, and we'll hopefully get people out a little bit earlier. I think today we have Morgan Watkins and Eleanor Buckley and Shelby Lofton with us today, and then I have some questions here. So I will go kind of in order and then back and forth to the questions. Shelby, you want to start us off?
The Kentucky State Police posted and said that they've been overwhelmed with the number of 911 calls. People are calling in talking about the no travel order. What would you advise Kentuckians do? And will there be bridges and roadways closed?
So Kentuckians should not be calling 911 with questions. They should be calling 911 with emergencies. And they should call any other number with questions. They can call, if they need to, the coronavirus hotline. They can call state government. And the travel order is really important. But no, we are not going to have National Guard or state police at this time closing off roads in and out of Kentucky. But this travel order is really simple. It's about making sure that contacts from a different region don't come into ours. And remember, we don't want you traveling anywhere. We don't want you traveling to another county and spreading contacts there, but we certainly don't want contacts from other states. Now, let me say that this challenge that we face is difficult because we can't see it. You know, when I was growing up during the Cold War, there was a face to who we believed was the enemy at that time, and we can't see it now. And we are hearing a lot of reports of or claims that, oh, we got a lot of New Yorkers or Floridians or people from New Orleans coming up, and there may be some of that, but that's also us and the anxiety coming out. It is just as bad when a group of Kentuckians come together in a crowd right now. You know, again, that we are all in this. We're in it together, and let's make sure that as we're thinking through it, we're just as worried about our local community. Remember, the travel ban has a couple of exceptions. The one we get lots of questions about is, but I work right over the border. Well, work and where you go to work is an exception. Caring for a loved one is an exception. A court order, visitation for your kids if they are in a different state is an exception too. County officials in Lyon County confirmed 4 cases so far tied to 1 nursing home. Can you address whether nursing homes are getting the support they need to test and to stop the spreading of the virus? Nursing homes absolutely must be protected during this coronavirus. It's why we have very earlier than most states, limited any visitation, and why these nursing homes are taking significant steps. Let me say with this specific nursing home that we have had multiple conference calls with them, have provided significant advice, and we have in fact tested, I believe, the entire wing that person or the entire wing that person was on has been tested, which I believe is the most significant step and the most testing we've seen in any of these facilities that have had a positive. But 4 in the facility, it's concerning. That's how this virus works. That's why we got to do everything we can to make sure it doesn't get in a facility in the first place. And we want to work with that facility. We want to work with the local health department. We want to do everything we can. But my message there is we're here to help. And thus far on the testing side, it is the most significant amount of testing, given the very limited resources we have of anywhere across the Commonwealth. Are states like Kentucky competing with private companies for PPE from the Strategic National Stockpile? What do I think about that? what percentage have we received from the strategic national stockpile? I'm still having trouble getting that percentage number because when the strategic national stockpile normally does things, you get amounts by population and your percentage of the population. But now there are separate requests that are out there. There are shipments being sent that don't line up directly with that. On top of that, we request supplies from HHS through a contract that we had, and we try to buy it in other ways. Our biggest problem is that just about every single order that we have out there for PPE, we get a call right when it's supposed to be shipped, and it's typically the federal government has bought it or has been told not to send it. It's very hard to buy things when the federal government is there, and anytime they want to buy it, they get it first. Again, I know other states are dealing with this too, and I'm not feeling sorry for myself or for us in Kentucky. Everybody else is facing this, and that's why we look to buy it. If we can't buy it, we look to manufacture it. If we can't manufacture it, your donations are even more important. Eleanor.
I know we've gotten some calls from viewers that have, shared custody, or one parent has full custody and visitation, and they're concerned about that scenario. Do you have any advice?
Right.
Or words?
Question is about visitation, shared custody. We still, those are court orders, and we still think that kids need to be able to be with both parents pursuant to one of those orders, though we should be really thoughtful about the where and the how that we do it. It makes it even more important that people are limiting those contacts and limiting their contacts. It's every time that there is that extra step or thing you can do or thing that you need to do in this that you almost have to draw a tighter circle around you, a closer bubble. It's like all of our first responders whose kids can still go to a daycare type facility. Well, what that means is there's a lot more contacts with those kids, and so it's even more important that when those folks go home, they don't see anybody else. And I think that's the same challenge here. But remember that the emotional health of your kids is so important right now. I sat up with my son last night before he went to bed. I normally just read to him, and I asked him how he was feeling, and he used words like anxious and sad. And he's a kid that if I don't ask wouldn't tell me that. And so I think it's more important now than ever that we try to be sensitive to how our kids are internalizing this, even if they don't show it. We talked about the cloth masks. Will I wear a cloth mask under appropriate circumstances? The answer to that is yes, but I haven't been in a car in about 18 days. I'm trying to model what I'm asking everybody else to do. I've only been in 2 places in 18 days, and that's here in the Capitol to do this and to do my job, to try to buy PPE, to make the plans to expand our healthcare capacity and home. I haven't been traveling around because even though I'd like to go out there and I'd like to say to everybody who's providing a meal, thank you for what you're doing, I'm asking people not to spread and share those contacts, and I'm trying to model that type of behavior too. Morgan.
You mentioned that you're running into issues with, you'll have an order that you've made with a company
Right.
for PPE, and then the federal government, you said, will either buy it or you'll find out that the company's been told not to send it. Can you explain what you mean by that? I mean, are they saying why? Are they being told by the feds not to send it, and why? So
the question is a little more detail on my statement that every time we expect an order of PPE, it doesn't come. Well, certainly the N95 masks don't come. I think we are getting a shipment of gloves and have gotten some other things. We have a Lexington company making face shields right now. But what will happen is either the vendor who is supposed to be sending it to us will tell us that the federal government bought it, typically FEMA, or all of a sudden there's an issue with it. And we can't ship it now. Well, why can't you ship it now? And what we'll find out in the next couple days is that the federal government has bought it or it's been directed that they ship it there. The challenge that we have is that we don't have direct producers of this in Kentucky, so we have to get it in. And then a whole lot of this right now is coming from overseas, and it never makes it past that port of entry to come our direction. Instead, it's diverted elsewhere. And listen, we need it, and my job is to fight for it. New York needs it too. New Orleans needs it too. Florida needs it too. California needs it too. I just want to make sure that hopefully after they get past a peak, and I really hope that they're coming close to their peak, that there's still enough out there for all the rest of us that are going to hit our peaks later. Let's see. Regarding a nursing rehab center in Louisville, a Kentuckian says the facility is bringing in beds to house dozens of patients by the middle of the month. I don't know, and there's a reason I didn't read the name here. I don't know about this specific facility, but we have asked all of our major hospital systems to create plans to expand. I mean, they've got outpatient centers, they've got rehab facilities, they have a lot of other medical facilities that might not be a typical hospital, but are sterile, have a lot of equipment on hand, and may have personnel that normally works there. And so if folks are seeing or hearing about this, it's a good thing. It's how we ultimately expand that healthcare capacity. Go back through Shelby. Another?
Could you repeat the name of the man from Boyd County?
Yeah, it's Aaron Jordan. Aaron Jordan. Morgan.
We got a question from a reader who was wondering if you were looking at doing anything to try to remove any barriers to using EBT cards for online grocery shopping, so that'll mean less people in the stores.
That is a question for Secretary Eric Freelander. Are we looking at ways to remove barriers from EBT for online orders? And I know we've talked about this.
Yes, we have. We've asked the federal government for a waiver from those requirements, and we are waiting to hear. So there are many things that we've done with EBT. SNAP, or how you help get to purchasing groceries, and we've asked for a lot of flexibility there, and we're going to make that as easy and flexible both to get those benefits and to be able to spend them and use them in ways that make sense.
Okay.
Well, I had an EBT question as well, but one person called our newsroom and said that she is in a wheelchair, but she doesn't want to take the Wheels Plus. She wants to get it delivered, but she's not able to use her EBT card curbside, and so that's just another hurdle.
Yeah, the question is about a specific individual in a wheelchair that doesn't want to have to travel on the bus right now, and that makes a whole lot of sense. And wants to be able to get that food delivered as on benefits. We'll work with her directly if you can connect us, and we'll make sure that she gets what she needs. All right. What's my response to the Maryville, Kentucky pastor who says he's going to continue defying the state ban on mass gatherings to hold services at Maryville Baptist Church? If you are still holding mass gatherings, church or otherwise, you are spreading the coronavirus, and you are likely causing the death of Kentuckians. It's that clear. If this pastor wants to still hold a live service, and there are at least reports of people going door to door, you cannot go door to door right now for any reason. Trying to encourage people to go, I mean, folks, that's how people die. That's how we go from the strict compliance, we show it again, James, to the poor compliance. Folks saying, even though the coronavirus has already killed 40 people and we know it's spreading, and we have 90 plus new cases every day, we're still going to get people together, especially in a setting where older and vulnerable people go. Yeah, that's how we move from the smaller curve to the bigger curve. I've said this numerous times. My church is incredibly important to me. My faith is incredibly important to me. It's an important part of my family's lives. My kids every Wednesday night now on Zoom are practicing their church musical, and this is the year where my two kids are two of the leads, and they don't know when it's going to be, but we care about each other in this state, and our faith would guide us and give us the wisdom to do the right thing to protect each other. Yeah. Anybody else? One more.
In terms of the ventilators, I know you were talking about that being really hard to get now. Do you have a sense from hospitals? You know, you've shown that slide multiple times with
Yeah.
how many we have. Are you getting a sense from hospitals? Are they okay on ventilators? What is there a target goal?
So the questions on ventilators and how hard they are to get. What we're hearing from hospitals first is they are thinking about new ways for a hospital grade ventilator to potentially be able to service more than one person. I mean, they are. We've got some really good hospital systems in Kentucky, and we are lucky for that. I mean, they are seeing this coronavirus as their duty. Their people are going into harm's way for it, and I've been really, really impressed. And so just because we have about 1,300 ventilators doesn't mean that that's not the capacity to serve more people. And we're nowhere near that capacity right now. We have more ventilators than people who have tested positive for the coronavirus right now. But the challenge is when you see the spike, even if it's lesser, when you hit the point where you have more people who would need a ventilator than you have them. Certainly with the limited action, you absolutely hit that. But the more we flatten the curve, the more we use social distancing, the more likely we are to have a ventilator for everybody who needs it. You know, the other thing that our hospital systems are doing a good job on, and this isn't factored into the models because this is a complex and a dynamic situation, is that they're actually treating people less days than anticipated in the hospital. They're getting people stabilized, getting them well, and getting them home to recover. And that's a good sign to me for our beds especially that we need. If you can get somebody stabilized and then they can ride out the last week potentially at home. So to everybody out there, thank you. Thank you for what you're doing. When we showed you that flu slide, your social distancing is working. We are not in the limited action up there. You all have committed, and we've had to enter the orders to make sure that we will protect people and we won't face that scenario. But I still need your best. I need your best over a beautiful weekend. I need your best next week. I need your best the next week after that. Our goal is to make sure that we are part of that strict compliance. And when you think about the fact that it could be the difference in 11,000 Kentuckians, it shows you how important that is. This is our chance to be a great generation, to pass our test of humanity, to say we care more about the health of other people than our economic certainty at this moment. And for anybody out there that disagrees with the actions we've taken, I hope you look at this. We are better people. We are better people than to allow either the limited action or the poor compliance to be our reality. This is our time as Kentuckians where we prove what we've always believed, that we are special and that we care about each other, and this is one of the best places to call home in America. So be healthy in your home. Spend time with your family, walk those dogs, make sure you protect your mental, your physical, and your emotional health because we're going to get through this, and we're going to get through it together. Thank you all very much.